Good evening. Can you hear me well? Okay, nice big crowd tonight. Thank you all for coming. And again, I hope at the end of our talk tonight, I will make some difference. I'm trying to raise awareness of a lot of things here, including, we're going to talk about nutrition and diabetes and cholesterol and heart disease. I'm hoping at the end of the day that I will change some minds tonight, or I will change some things you do on a daily basis. Many of us actually try, that's why you're here tonight. We try to live healthy and do the right thing. Sometimes we don't have the right information, and sometimes we have it, just don't know how to implement it. So there are going to be a lot of slides. Actually, the last time we were supposed to have this, we didn't have the slides. And the slides are just simply a guidance. You can look at them, but feel free to stop me with any questions. I'm going to leave enough time at the end for you to ask any questions. By the way, I did this, I volunteered to do this, and the hospital obviously helped with that, but I'm not being sponsored by anybody. I'm just doing it for all of you here. So why are we doing all of this? We all want to live healthy, and living healthy actually pays big dividends. On average, a healthy person lives about 14 years more than somebody who chooses to live unhealthy. And we're going to talk about that later on in details. The average healthy person lives 7 years more than the average person. So it's not only about how many years we live, it's about quality of life. We enjoy life more. And we stay away from hospitals and nursing homes and so forth. So it pays actually big dividends to live healthy. There's an old saying that the older you are, the healthier you have been. And this holds true all the time, almost. Now, we're going to talk later on about diet and weight loss and all this, and it's just part of living healthy. If you lose about 5% of your weight, you reduce the risk of diabetes. Also, blood pressure improves, cholesterol, both bad and good cholesterol. The good cholesterol goes up, the bad cholesterol goes down. So there's a lot of benefits to that. And if you lose weight and live a healthy lifestyle, you're going to take less medications, and it's going to cost you less. And you're going to spend more time enjoying your life rather than seeking medical care. In many cases, people look at living healthy like it's a punishment or it's too much of a burden. Actually, you can enjoy almost everything in a reasonable way and still enjoy that. Exercise is not a punishment. Eating healthy is not hard. You can still eat brownies and enjoy life. It's about moderation. It's about, the bottom line is about how much we eat. It's what we eat, when we eat it, and how much we eat. And it's not only one thing that makes us healthy. It's about exercise and diet. It's about listening to medical advice. It's about having a positive attitude. So it's not about one thing. I mean, if we do one aspect of it, sometimes that doesn't lead us to the health that we're hoping for. So we're going to start talking about cholesterol. And why do we want to do that? First of all, it has been proven 100% that cholesterol leads to heart disease. Extra cholesterol in the blood leads to heart disease. It's not something we're questioning. It's a fact. So it has been proven in multiple trials, primary and secondary trials, that meaning for people that are healthy on the surface and people already have heart disease, treatment of cholesterol is beneficial. It has been proven. It's not one or two trials, multiple trials. So that's why it's important to pay attention to cholesterol and treat it. Now, as of now, cardiovascular disease is still the #1 killer. More people die from it than any other disease. One in every 3 deaths in the country actually happens because of heart disease, and 635,000 Americans have a heart attack for the first time once a year. Half of them almost have a recurrent heart attack. So the impact is enormous, both on the health and on the economy. I'm not going to bug you down with history or chemistry. This is the whole thing about cholesterol is complicated, but the bottom line actually is simple. So if cholesterol is that bad, why do we need it? Actually, cholesterol is not bad. It's the excess bad cholesterol that's bad. Cholesterol does a lot of good functions in the body. As you can see on the screen, I mean, the hormones that our bodies make have cholesterol in them. They're built out of cholesterol. The bile acids have cholesterol in them. The cell membranes in every cell in the body has cholesterol in them. So the cholesterol is important. It's when we have excess bad cholesterol that, as I'm going to show you later, gets into the arteries and blocks them. This is when we have a problem. This is slightly complicated. So the cholesterol in the blood does not just flow with the blood. It cannot do that because it doesn't like water. We call it hydrophobic. So the cholesterol in the blood actually travels in boats. We call them particles. And this is something new where sometimes actually the cholesterol is down, but the patients continue to have risk, continue to have heart disease. It's because they have too many boats, too many particles in the blood that need to be also lowered down. And, you know, a lot of new information is out there. And again, we're not going to talk chemistry and biology and all that. I'm going to try to keep it simple. Part of that is genetics. Some of us are born with too much cholesterol. But in the meantime, our lifestyle, what we do, controls a big portion of that. So all of you heard about the good cholesterol and the bad cholesterol. And I'm going to touch base on that. It's not, you know, the good cholesterol is not always good, but for the most part, we like to have more good cholesterol. As you can see on this slide here, the yellow bad cholesterol is the one that gets into the arteries and blocks them. So the good cholesterol has this function where it goes back to the arteries, picks up that bad cholesterol and takes it back to the liver. So we want more. It's like a dump truck. We want more of this. And part of that is genetic. Part of that depends on our lifestyle. And there are conditions where in certain populations, like in certain populations in Japan, they're born genetically with high, what we call HDL or good cholesterol, and they rarely have heart disease. The problem that we have strong medications that would lower the good cholesterol, the bad cholesterol, easy. We can drop it 50, 60, 70%. We don't have strong medications to raise the good cholesterol. Therefore, we have to use every other tool we can to raise that good cholesterol. And that's where diet, exercise, maintaining a healthy weight, living a healthy life is important. As you can see on this slide also, I don't know, it's your left or my left as you face, but the one that's open there, that's the way we want our arteries to be. And obviously, as you go to the right, with more cholesterol deposited, you have more restriction. Actually, it's not, it doesn't mean always if you have a blockage to a certain degree that you're going to have a heart attack. Actually, over half of the heart attacks happen in arteries that are less than 50% blocked. There are many other factors that play a role here. I'm sure all of you or most of you already know their cholesterol. Some of you may take medications already. In the past, we used to pay attention mostly to the total cholesterol and the triglycerides. It's not the case anymore because many people with normal cholesterol, they still have heart disease. Many other factors play a role, especially in diabetics. The cholesterol may look actually normal, but it's not, and we have to look deeper into this. And I will show you something about that later on. Another misconception is that it all depends on our diet. It doesn't. Actually, most of the cholesterol in the body is controlled by the liver. The liver makes it, and that's why if you are genetically predisposed to this, you have to take medications. So the diet is good, actually. It controls a portion of that, up to 20%, but the vast majority of cholesterol is actually made in the liver. This information may actually surprise you. When we see somebody who has heart disease in their 40s or 50s or 60s, I want to leave enough time for questions, that's why. It doesn't mean that they started building up these blockages 5 years ago, prior or 10 years. Actually, it takes decades, 30, 40 years. They proved that in studies in children and teenagers. So this is where we're actually trying to focus more now, treatment as early as possible. Most of the time we treat after the fact, or we treat mostly older people when they have already established blockages or disease. We need to start earlier. Actually, for families who have hyperlipidemia as a disease, we call it familial hyperlipidemia, we need to start checking children. And we are advocating to start checking the cholesterol of children in high-risk families at 2 years old and start treatment at 8 years old. In many cases, I mean, obviously, this is not your common patient out there, but there are 1 in 500 people who have familial hyperlipidemia. And these are the families that have early heart disease and so forth. And in these families, you need to start treatment early. Studies have shown, actually, if we keep the LDL cholesterol, which is the bad cholesterol, if we keep it under 50 or 60, we will not have more heart disease. This has been proven. I mean, it's not about just simply preventing it or keeping it at, it doesn't happen when you keep the LDL low. So it's worth it to take medications. These are 2 studies actually that were done on children. One study, we call it the P-Day study, 3,000 people, young people died from different causes, accidents between the ages of 15 and 34. When they did autopsy on them, they found out that big portion of them, up to 30%, had blockages. These are normal walking kids, teenagers. And some of them had significant lesions. We will not know about it as physicians until they hit their 30s or 40s or 50s. And the same risk factors that apply to all of us apply to these kids. We feel like they can get away with it, they can eat their sweets and eat their junk food. Actually, they have as much risk as the adults, especially in high-risk patients. This is, I want you to pay attention to this because we have the mindset of treating things when we feel bad, when something is bothering us. The things that kill most people are silent killers. Actually, hypertension, diabetes, and cholesterol, they're silent diseases. We don't feel them. When we feel them, it's too late. So in the people that have heart attack for the first time, over 72% have normal cholesterol. For people that have a recurrent heart disease, it's about 41%. So the question is, if the cholesterol is normal, how come they have heart disease? Well, the problem is that we don't look deep enough. We don't treat people according to the guidelines. And I'm going to talk to you about some history there where, 30, 40 years ago, a cholesterol of 300 was considered normal. We don't consider that anymore. So the guidelines have changed, and things have changed a lot over the last 20, 25 years. As a country, we're more aware of it. It mostly started in the late 80s and 90s. Actually, the first statin drug came to the market in 1987. We still were not using them aggressively, but over the 90s and the last 15, 20 years, we started realizing more that aggressive treatment is warranted and early treatment is actually beneficial. There are some sad facts that most people that have high cholesterol are not being treated or not treated according to the guidelines. In 2005, there was the Neptune study, almost 5,000 patients, showed that 67% of the patients were treated to their goal. And that included also high-risk patients. Only 2 in 3 were treated to lower their LDL cholesterol to where it needs to be. And this shows you how the guidelines have changed over the years and so forth. So there are new things that we're looking at now. The old-fashioned way, we will look at the total cholesterol and we look at the bad and the good cholesterol. That was good 10, 15 years ago. Now we're looking deeper into this. And why? Because I told you over half the patients, 72%, they have normal cholesterol. So if they have normal cholesterol, what's wrong then? Again, because we don't look deep enough. So nowadays we don't look only at the LDL or the bad cholesterol, we look at the particles. If the particle numbers are elevated, that increases the risk almost twice, almost 200%. We break the LDL down, we break the HDL down. We look at what we call the ApoB part. Now, the ApoB, as I told you before, maybe you haven't heard of it, that the cholesterol in the blood does not flow with the blood. It's not liquid. It travels in particles, in boats that carry it. So we found out that these boats, these particles, correlate more with heart disease than the simple cholesterol number itself. And there is a special kind of cholesterol, we call it Lp(a). That cholesterol runs in families, especially in families with heart disease and people with recurrent heart disease. This is the most resistant cholesterol to treat. And there are some new medications that are in the pipeline for that. So there is much more to look at than simple cholesterol. And also we look at the inflammation factors. So when somebody has a heart attack, it's not only about the blockage. The blockage makes it easy. As I told you before, most people that have heart attacks, the blockage is less than 50%. It's not 95%. So for the heart attack to happen, you will have to have a blockage, and that blockage has to rupture. When it ruptures, then a blood clot forms, and that causes the heart attack. We found out that in certain things that we call them inflammation markers. So if you have more inflammation in the body, especially in the blood vessels, that makes that risk even higher. So the two markers on the screen that you see also associated with that. So maybe some of you have already checked their CRP. It's very, very important actually to check that, because it creates the environment for these blockages to rupture and cause more problems. There was a study that was done 5 or 6 years ago. They took normal people, no heart disease, no diabetes, nothing. Men over 60 and women over 50. Again, their cholesterol wasn't high. They didn't have heart disease. They didn't have diabetes. They were just your average person. And they put them on high-dose Crestor. If you heard of Crestor, it's the strongest cholesterol medicine we have now, statin. The only thing that they checked in these people, they made sure that their CRP was high, above 2, meaning their inflammation was high. And they found out, the study was supposed to go on for 5 years. They stopped it after 2.5 years because the benefit was enormous. They did not want to deprive the patients that were taking the sugar pill, placebo, from the benefit. After 2.5 years, they stopped the study because there was almost 50%, 54% decrease in heart attack and stroke. These are people that don't have heart disease, don't have any problems, average cholesterol, not very high. All what they had, give them that medicine, and they had the inflammation marker high. So this is really important. You probably, most of you have seen this nutrition pyramid that we actually don't believe in it anymore. It actually caused more problems than benefits. The idea was behind it for many, many years. The emphasis was to eat more vegetables and fruits, and at the bottom, to eat more carbs, but good carbs, fiber, whole grain, and all that. We took it to the extreme, and we started doing more carbohydrates and sweets and desserts and ice cream, and we ended up with more obesity and diabetes than we ever had before. So as I'm going to show you later on, we want to look at that without the bottom part. We don't need that. So we eat healthy because we want to avoid disease. That's important. But if you eat healthy and you do the right thing, you're going to lose weight. You don't have to do separate things, actually. Healthy lifestyle and diet and exercise is good for your heart to prevent heart disease, but it's also a good way to lose weight. You don't have to go to extremes. One thing that I'm going to talk to you about later on is that what you eat actually is not that important as much as how much you eat. So obviously you want to go on a diet that has low fat, low saturated fat, low red meat, more vegetables and fruits and all that. But you know, over the last 10, 15 years, there has been a lot of talk about low carb, high protein diet, low fat diet, and so forth. This is not as important. They did a large study recently, about 900 people. They put them on 4 different diets. And it ranged, I'm going to show you that later on, there's a slide about that. It ranged from low carb to low fat and low protein. They divided them, and at the end of the study, they found out that weight loss has nothing to do with the composition of the diet. We call it the macronutrients. It had to do with compliance, adherence to the diet, and it had to do with the amount. It comes down to the calories. Regardless of what you eat, if you run a positive balance with the calories, you're going to gain weight, and the opposite is true. One important thing about the implementing a healthy diet is to start right away. I know somebody is serious about quitting smoking when they take that pack in the office and put it in the garbage. When they tell me, you know, I still have a carton at home, I know they're not serious. So you need to start right away. Don't say, okay, I'm going to start after Christmas, my birthday is coming up. Do it right away. It helps also to get family members on board because that makes it easier. You don't want to cook 3 or 4 meals at home. And studies have shown that when you do it with a partner or with family, you're more successful. Obviously, you can't do it on your own. It's preferable to do it under supervision with a nutritionist, with your doctor, and so forth. And there are ways where we can arrange that. Have you seen this? Our diet special is a fresh garden salad served in burger, shake, and fry containers. So actually, it's much easier to say what's unhealthy than what's healthy. So we can tell you easily what you shouldn't eat, but it's hard to encompass everything healthy in one diet. So that's why I tell people you can design your own diet. You follow certain principles. I don't like actually to call it diet. I call it a lifestyle change. Diet, feels like you're going to prison or something. I mean, a lifestyle change should be comprehensive, which includes activity and all that. The problem that sometimes people eat unhealthy things and they don't feel guilty. It's like nothing happened and so forth. And that's important. We should be aware of that. We eat all fast food in a hurry and so forth. As I told before, that the food pyramid that was recommended for many years before did not do us any good as far as being healthy, because it led to a lot of what we call insulin resistance, weight gain, and diabetes. As I said before, that the choosing the diet is not as the macronutrients or what you should put in your diet is not as important as the calories. You should follow healthy principles. And again, avoiding, we're going to talk about that, avoiding fried food, cutting down the red meat, more vegetables and fruits and so forth. In more than one study, it has been shown to be more helpful than simply say, okay, I am not going to eat bread from now on. You know that's not going to happen. You can't maintain that. When you think of a diet, think of something that you can maintain long term, because the whole idea is to do it long term. 95% of the people that lose weight gain it back within a year. Why? Because they choose a diet that you can't maintain, or they start an exercise program that is too aggressive and they can't maintain it and so forth. You have to choose something so you can do it long term. So as far as weight loss, you can do it in so many different ways. You can say, okay, again, with your physician or nutritionist, or it's not really hard. In general, we know that limiting calories up to 1,500 for males and 1,400 for females, that usually achieves good weight loss. Now, it depends on their lifestyle, how much exercise they do, and their size and so forth. That's why you need professional help. But in general, if you calculate your calories and you do about, let's say, 2,500 calories a day, if you go down to 2,000, regardless how you do it, you will achieve a 1 pound weight loss a week. That's 52 pounds a year. It's math. It's proven. And that's doable. I mean, for some people, if they like soda and they drink 3 sodas a day, that's almost 500 calories, give or take. By giving up the soda, you lose a pound a week. That's a simple thing to do. It's not, sometimes it's sweet tea, sometimes it's that bowl of ice cream at night, whatever. But the idea is you have to achieve a negative balance in your calories. Or, as I said, you can, without calculating and all of that stuff, you say, okay, I'm drinking 3 sodas a day, or I have 2 sweet teas a day, or I have a bagel every morning, whatever. If you give up certain high calorie, dense, and most of the time it's unhealthy food, you will achieve weight loss. It's not really hard. As I said, you can discuss that with your physician, and it depends on a lot of factors. But in general, you can do it, design your own diet, and do it your own way. You don't have to do exactly what your sister or brother or neighbor does. It may work for them, not work for you. The National Institute of Health several years ago came up with the DASH diet. It's actually, the diet was invented for hypertension. The DASH stands for Dietary Approaches to Stop Hypertension. But as I said, any healthy diet will work for diabetics, for heart disease, for hypertension. So the main principles is to do more vegetables and fruits and low-fat dairy products and fish, cut down on the red meat and high-fat dairy products, and include canola and olive oil, and cut down on the fat. we should go for a fat less than 30%, saturated fat, the bad fat less than 10%. Feel free to stop me and ask any question if you want. I'm going to allow some time. Where's Georgia? I'm going to allow some time, like 15, 20 minutes for questions. So there is no magic food. There is not one food that you can eat or stop eating and be healthy. That doesn't exist. It's simple, but it's more complicated than that. So, for example, for many years we thought eggs are bad for you. It was actually a physician health study that showed if you eat up to 6 eggs a week, you're fine. If you eat 7 eggs a week, you're going to increase your chance of dying by 23%. But many other studies after that showed that that's not true. So goes back to the principle that there is not one bad food or good food that will make a lot of difference. One thing I would like to talk to you about, because this is something that's rarely talked about, is the difference between glucose and fructose. Many of the foods that we eat actually has fructose in them, or what we call high fructose corn syrup. The food industry uses that mostly because it's sweeter, but it's cheaper also. The problem with that is that number one, it gives us a sense that okay, we're not doing that bad, but actually it increases the fat in the abdomen. It causes more diabetes than the regular sugar. And in studies, it has been shown to increase the fat in the liver also. So, I mean, avoiding sweets is not necessary, but cutting back significantly, especially on the artificial sweeteners, is important. You may have heard that the glycemic index a lot. It's really, really important if you want to follow a good, healthy diet. The glycemic index means how much the food you eat raises your sugar and how fast. It's really important. So we use the glucose that as a benchmark, 100, and everything else is measured to it. Foods that have high glycemic index, they raise your blood sugar a lot, and they're bad for you. So look at complex carbs or like oatmeal or fiber in general. It's carbohydrates, but low glycemic index. So you get your carbs, but it doesn't raise your sugar. So that's really important. Fiber is really important when it comes to your food. It has been, again, proven in study after study that if you eat more fiber, you decrease your chance from having heart disease and even death by 27%. That is significant for a simple maneuver like this. The fibers come in viscous, soluble, and non-viscous. The viscous fiber, which is the one that's soluble, is more useful. And that's mostly in cereal and oats. There's an ingredient we call beta-glucan that is really useful. By itself, 3 grams of beta-glucan a day lowers the cholesterol by 4.4%. That's one thing you can do in the morning on top of everything else. So in general, you have to eat more vegetables and fruits. You have to eat whole grains. You have to eat fish twice a week, or take some fish oil. We're going to talk about that. You have to use olive or canola oil. Now, when it comes to exercise, that's tricky because everybody has their own preference. People have joint problems, back problems, and so forth. So don't be a hero. The whole idea is to be active. And how you do it should depend on your age, if you have any medical issues, and so forth. And that's why many people actually stop exercising, because they try to do so much right away, and immediately they feel it. In general, we say to start about exercising 3 or 4 times a week, about 30-40 minutes, and moderate exercise. We're going to give you some details later on. So if we do about 150 minutes a week, which is 30 minutes a day for 5 days and increase it gradually to about 300 minutes or burn about 2,000 calories. Ideally, we should try about 30 to 60 minutes a day. It doesn't have to be all at the same time. You break it down in 2 or 3 sessions. Actually, there are studies to show that if you break it down, it's more beneficial. Try to go 5 days minimum. Studies have shown that if you go 2 days without exercising, you lose the benefit. So every other day is the maximum you should skip. Don't skip more than 1 day. I tell people that do it 5 days a week, and you can don't take the 2 days off together. Do it some in the middle of the week and take Sunday off. So again, don't be a hero. You may hurt yourself. And don't go for exercises that get you frustrated. If you join any class, that's why I like the YMCA, by the way. You go there and there's something for every age, for everybody. You shouldn't be embarrassed. If somebody is running on the treadmill at 10 miles, you shouldn't do that if you're not able. Just walking is the best thing you can do, and it's available everywhere. We know for a fact that if you're active, you're going to have less problems, you're going to live healthier. But the problem is that only 15% of the population is active. Only 15%. Actually, 1 in 4 are completely inactive, sedentary, and 60% somewhere in the middle. Here is the good news. Some people tell me, oh, it's too late for me, I can't. Actually, for an inactive person to start walking, they get more benefit than an active person who starts running marathons. So it's never too late. Start and build up gradually. Start low and go slow. So what does exercise do? I mean, it's enormous benefits. It's not only the weight loss. Weight loss is only a small benefit. It lowers the triglycerides, it raises your good cholesterol, lowers the bad cholesterol, it lowers your blood pressure, it lowers the fat in the abdomen, which is the most sickening fat, the worst fat in the body. And remember we talked about inflammation? When you exercise, the inflammation goes down, which means your cholesterol, even if the number doesn't change, your cholesterol is less harmful with exercise. And if you burn 2,000 calories a week, the cardiovascular mortality goes down by about 30%. That is significant. Again, it's 30 minutes, 5 days a week, and this benefit is doesn't apply only to certain population. It's old, young, men, women, diabetics with heart disease. So this guy hasn't exercised for ages, and he decided to do it all in 1 day. We don't want to do that. This is what we want to do. When I enjoy it with a partner, start walking. And if you enjoy another activity, do it. It's all about raising your heart rate. Don't do this because you may hurt yourself. So I'm sure all of you, or most of you, take some kind of supplement. And I'm going to talk about a couple of supplements here. You can ask me questions about other supplements if you like. One supplement that has been proven to be beneficial is fish oil or omega-3 fatty acids. In summary, I would tell you that you don't have to take a lot of it. Now, for people that have high triglycerides, over 500, they need a lot of it. They need about 4 grams a day or 4,000 milligrams. For the ordinary person, you need about 500 milligrams a day. If you have heart disease, your goal is 1,000. When I say the milligram, I don't mean the number you see on the bottle. That does not reflect the actual fish oil in it. So you have to look at the label and make sure you add up the EPA and DHA. These are the 2 useful omega-3 fatty acids, and you add them up together and you come up with that number. So you need to add these because the fish oil has a lot of other ingredients in it. So make sure you read the label. Now, some people ask, okay, is flaxseed as good? No, it's not. Flaxseed does not have EPA and DHA. Krill oil or fish oil, they both have enough quantity. They look different because if the way they're mixed, but fish oil is actually more in phospholipids, and krill oil is more actually with triglycerides. That's why krill oil looks darker, but it has enough EPA and DHA. How did we know about this? Actually, they noticed that about 40, 50 years ago. They did studies in Iceland on Eskimos, and they noticed that the locals that eat a lot of fish food, they actually had less heart disease than the Danish settlers, and that's how the whole thing started. Many people take non-prescription omega-3 fatty acids, which is fine, it's not regulated. So you have, you have to trust what they do. I mean, most of the time, the ingredients are correct, but again, do your math there. Many people don't like the taste or the aftertaste. When you freeze them, keep it in the freezer, that minimizes that and the side effects you have with it. How many people heard of red yeast rice? So for many people that need to take cholesterol medicine and they can't tolerate the statins, they take this. So it's okay because actually it has some statin in it, lovastatin, which is the first statin that came to the market in 1987, but it has a small amount of it, so it's better than nothing. The problem is if you have muscle pain and you take too much red yeast rice, you may still have muscle pain even with the red yeast rice. In certain cases, actually I don't encourage it. Personally, I think usually it doesn't do that much, and it has some side effects. You may end up also with the same side effects, and it may contain citrulline, which is actually harmful to the kidneys. So I encourage people that take red yeast rice to try to take something else in smaller. We're going to talk about that. If you don't tolerate statins, what do you take? So do you take garlic? No. Garlic has been proven to be useless. So you can take it. It's not harmful, but as far as cholesterol, it's useless. When you take niacin over the counter, make sure it's not the flush-free niacin. It has to contain niacin in it. Some of these flush-free niacin preparations, they have niacinamide, which doesn't have the benefit of niacin. And I'm sure some people here take CoQ10 because that has been advocated, that's good for you. Actually, when we take statins, our CoQ10 in the body goes down. But it has not been shown to be harmful, number one. Number two, it doesn't go down in the muscle. So some people believe that, oh, if you take it, then you have less muscle pain with statins. That has not been shown to be the case. Another thing that will surprise you, actually, and I talk about this a lot, is vitamins and supplements. Most of us do that and do it because we think it's healthy. Everybody does it, and so forth. In many cases, they're not harmful, but in many studies, they have been proven to be useless. Actually, the Cochrane Review, or used to be called Collaboration, is about 31,000 volunteers in about 130 countries that look at medical data they're not tied up to any companies, it's unbiased, and they present that information in an unbiased way. You can actually go on the website. They reviewed 78 trials, almost 300,000 patients, and they concluded that antioxidants and vitamins are not beneficial, primary or secondary prevention. Actually, they showed that beta-carotene and vitamin E may be harmful. So some of us take, okay, for cancer prevention, for this and that. It's not true. It has not been shown to be useful. So what do I do when somebody come in with, I don't discourage it. In certain populations, when you have documented vitamin deficiency, of course you need it, definitely. Vitamin D, vitamin B12, thiamine, and so forth. But it has to be documented. If somebody does not eat properly, if you eat a balanced diet and you're not a vegetarian, because certain vitamins come only from animal food, if you're not a vegetarian and you eat enough vegetables and fruits and you don't have any stomach or intestine issues, you don't need any vitamins. You simply don't need them. And the advisory committee looked at that in 2010, and they concluded that beta-carotene, vitamin E, A, C, selenium, and zinc has no effect on heart disease. So the healthy population doesn't need to take it unless they have a documented deficiency. So in special situations, somebody had gastric bypass surgery, or an alcoholic because they deprive their bodies of certain vitamins, that's different. But if you're a healthy average person that eats enough protein and enough vegetables and fruits, you don't need a multivitamin. Although, you know, we look at it as something healthy. In many cases, it's harmful, actually. It interacts with your own medications and so forth. Remember, when a company makes vitamins and puts them on the market, they do not go through the same review and monitoring by the FDA. The requirements are much less. So you have to take that into consideration. You can easily get enough vitamins and nutrients through your diet without getting any supplements. So why we're talking about all of this? To prevent heart disease. And that's the ultimate goal. And you have to remember that the person you see here is not the standard person. Most people actually don't have the crushing type chest pain. Only 1 out of 3 will have that. Some people will just feel bad, will have shortness of breath, will feel weak. They will tell you just, I feel bad. They can't specifically say it, and it may end up being coronary artery disease. That's what we're trying to avoid, that blood clot in the artery that kills part of the heart. And now he has a different problem there. So we'll get back to the last part of it. We're going to talk briefly about this. This is the one thing that most of you hate, taking medicine. In some cases, medicine is necessary. We can't get around that. And many people, like this doctor actually believes that cholesterol pills actually themselves cause the problem. The problem now is that we take too much medicine, we take too many vitamins and supplements and all that, and that's not easy on the body. And people don't like to take medicine, and that's what causes actually many people that need to take medicine to be non-compliant. I like to pay your attention to this slide. Actually, every time I look at it, it surprises me. Out of every 100 prescriptions we write, only 50 to 70 go to the pharmacy. About 50% or so come out of the pharmacy, 1 in 2. And 1 in 3 only gets taken properly. And the sad part, look at this, 15 to 20 are refilled. And we're talking about medicine for, these are not my numbers. Talking about medicine for heart disease, for diabetes, for hypertension, and all that. Why? I'm going to talk to you about that. Number one is the cost. You go to the pharmacy, I wrote you a prescription, they tell you $500, okay, I'll come back next time. So cost is a major issue, especially for people with limited resources, Medicare, and so forth. Medication cost is really, really a problem. The other thing is side effects. And sometimes they're true and real, and sometimes they're manufactured. Actually, many people, when they look at the PI or the paper that comes with it, the real side effects, they won't take the medicine. Or they have the side effects even before they try it. Another problem, in my case, actually, I think it's the media. I mean, what we watch on TV and radio and internet, it's scary. Even for the medications that have been proven to be useful, they start telling you about the side effects, and if you don't die, you can't take this medicine. I mean, this is a problem, and social media also. I mean, if somebody had, calls their friend, they have knee pain, okay, that's probably your statin. And they had knee pain from arthritis for years. The bottom line is, there's not that many medications on the market that have been as useful and as cost-effective as statins. And many, I mean, almost over 400 trials have been done to show that their benefit for primary prevention for people who don't have disease and for people that already have disease, secondary prevention. And we can't tell you beforehand when we give you a drug what's the percentage, how much that cholesterol will go down. So it's predictable. And you know, they used to be very, very expensive, especially the good ones. Nowadays, we have some generic, cheap alternate, meaning available medications. And we have drugs that you don't have to take at night. We know for a fact now, if you take these medications earlier, I told you about the children earlier and more aggressive, then the benefit is enormous. So why don't we take statin therapy? I mean, I'm sure many of you have taken them and they, for one reason or another, stopped. Number one, there are some real side effects that we see, and some side effects that haven't been proven. Like the diabetes, does it increase risk of diabetes? Yes. Is it significant? No. So if your A1C goes up from 6 to 6.2%, it's okay. Don't be alarmed, because the benefit outweighs that. The benefit is enormous. Many studies have been done on statins to show that there is no relationship to dementia, because there were some reports that it may cause Alzheimer's and so forth. As far as liver disease, it's all exaggerated. Actually, we should not be checking the liver function every time. People, they worry about that. Most of the liver dysfunction that we see in older people is actually related to fat in the liver, not statin therapy. Does it cause kidney problems? No. One statin only, Crestor, rosuvastatin, we call it, may in high doses causes the kidneys to secrete more protein. It hasn't been proven. But if somebody has heart disease, we try not to go over 10 milligrams on that. We can't go higher than that. Although, again, the renal problems have not been proven. So the main issue why people don't take statins is muscle pain. And that's real. Probably 1 to 2 people out of 10, they will stop it, or they'll report that muscle pain. Some of that is true. Actually, we check the muscle enzymes, and even sometimes when the muscle enzymes are normal, they've done some muscle biopsies and they saw some muscle damage. So in these cases, we have several strategies that actually, I gathered this slide from multiple sources. What you can do, if you have diabetes, if you have heart disease, you have to be on drug therapy. So what do? You take the same drug, you take a break, a holiday, and you go back on a smaller dose. There are some statins that have a long half-life and can be given every other day or 2 or 3 times a week. As I said, I don't give the red yeast rice, but some people do that. But now, for people that have heart disease or people that are really high risk, the people that have familial hyperlipidemia, we have new drugs that are almost side effect free that we can give. And these are given by injections, and they're very, they lower the cholesterol by 70–80% without any side effects. But they're too expensive and they have to be approved. So that's about it. 55 minutes or less. Thank you. Thank you for listening.